Dr. Ryan here from Straight Up Spine and Posture. Today we're going to talk about disinformation, or more appropriately, dated information. One of the hardest parts about my job in dealing with people with chronic back pain or acute back pain is trying to have them understand that a lot of movements they might be doing in an attempt to fix their own back might be hurting it. And you've probably seen some of this information and you might be surprised by some of these. So we're going to try to keep it shorter, and we're going to go through three major movements that we see that patients are kind of classically doing and causing irritation. So let's talk about a little bit of the history of these types of things before we jump in. We'll edit below if you just want to skip to the exercises, that'll be there. If you're interested, then go ahead and listen. The big three that we see, the first one is for sure the Cobra pose or the McKenzie exercise, which is basically a reverse kind of a back extension. So that's a big common one. That's been popularized by Dr. Robert McKenzie, who is a physiotherapist from New Zealand. And it's kind of a fun story of how that exercise came to be. If you're interested in that, you can check out his book. Another famous spine person who was kind of involved in popularizing these types of things is Dr. Stuart McGill. Dr. McGill is a little bit of a genius, but his work has been kind of misinterpreted, and at the time it was the best information available. Nowadays we know a lot better about a couple things. So some of the ones that we're going to go through, some people I'm sure are going to comment that there's famous doctors who do that, and that's true, but that doesn't make them correct anymore. So let's dive right in, I suppose, to the first one, which is the Cobra pose. So without doubt, the Cobra pose is the most common kind of self-treatment that we have that patients do in an attempt to fix their back, and it can definitely irritate things. So if you're not familiar with the Cobra pose, allow me to demonstrate, and then we'll talk about why this is something you might not want to do for your back if you're having pain. So the Cobra pose in yoga, this would be the Cobra pose. In Dr. McKenzie's method, it might be done on the elbows or even just kind of with the shoulder blades. It doesn't matter how far you go. It just basically is not good for the spine. Now, let's talk about why that is. Generally, in the spine, with chronic pain, we're trying to do two things. We're trying to get people's hips, basically their butts, to work. Why don't butts work? We're sitting. It's not rocket science. That's about it. It's chronically stretched out. It's not strong. It's weak. Not durable. And the other muscles that are happy to do the job of the butt musculature is the back musculature. And if you have a tight back, that's because your back is overworking. So if we take a spine, and these muscles, when they contract, they produce extension of the spine, they produce arching of the back. If we're trying to get that from the hips, and I lay you flat on the ground, and then I bend your back into this position, it does two things. A, it will further activate these muscles, which is not helpful, and B, it'll compress the joints of the spine. Now, from a philosophical perspective, a lot of times, almost everyone is familiar with the idea that if you've got a back issue, you basically need to be working on your core, which is the front side of your body. And the reason that we would exercise a muscle is to attempt to shorten it and make it stronger. Now, if this muscle is assumed to be short, and it needs, if it's long and it needs to be kind of shortened and strengthened and things like that, what on earth does stretching that out do for it? It makes it longer, or in other words, makes it less strong. So it does the exact opposite of what the entire concept behind core strengthening does. And this is one of the reasons that it just doesn't make sense to me logically, but then also in the clinic, we definitely see injuries from this type of things. There's particular practitioners who are called McKenzie practitioners who use this. They do other things, obviously, and some of them are great, but stereotypically, a classic just straight McKenzie practitioner will do this with all of their back pain patients, and it just doesn't work. We get a lot of referrals from those types of things. So what does the Cobra pose do that's good? It does several things. And the reason we don't like the Cobra pose is there's better solutions to this, okay? So what we talk about here, the good stuff, there's some exercises that we do, which I'll mention in a moment, and you could go check out those videos if you want a substitution for the Cobra pose if you've been doing this. So one of the things that does really well, if I bring my back into extension or I drive my hips forward, it will stretch out the front of the hips, and those are most definitely tight. When I sit, it's not exactly rocket science that this muscle is shortened and it can be chronically shortened. That's called contracture. But basically the idea is if you stand up here, it won't let your hips go forward, so you arch your back. So arching the back further, is kind of dumb, so that's what the Cobra pose has an issue. But opening up the hips in the front, that's great. We like that. And so that's one of the things that it does well. In an attempt to remove the potential harm that this end range, compressed, exaggerated extension does to the spine, while maintaining the benefit of this exercise, that's what we like about the couch stretch. So if you're not familiar with that, or you want a substitution for the classic McKenzie extension exercise, Cobra pose exercise, you can check out our couch stretch video. So we'll link that below. All right, so that's number one, without a doubt, the most common thing that we see, the Cobra pose. All right, moving on to number two, that would be a classic toe touch or a hamstring touch. One of the reasons that this can be potentially irritating is it stretches the nerves. Nerves don't stretch. If you try to stretch a nerve constantly, you're going to irritate it. So we'll classically see this with people who have some type of a disc injury, and they'll have tight back muscles, and that can be irritating for sure. And so when they try to touch their toes every morning or whatever, classically, they'll just basically continue to irritate that nerve, and their back will feel better. And so this is kind of a classic trap that people will get stuck in. Is it makes their back feel good, but then the next day their leg will be acting up or whatever. So just a disclaimer, trying to treat your own disc injury is a bad idea. You should definitely get professional help for that. But there's some other reasons that we don't like this in general. So allow me to demonstrate. Again, generally what we're looking for the hip and the back is we want the pelvis to be rotating backwards. We want the core to be strong and stable. We want the back muscles to be kind of relaxed. Glutes should be strong. Front of the hip generally needs some release work. So, in other words, we want that pelvis to tilt posteriorly versus anterior pelvic tilt is not super comfortable. I look kind of foolish here and my back does not feel great. So if you're stuck in this, like, shocker, you're gonna have back pain. So if you pay attention to what my hips do here, as I bend forward on the way down to the ground, my hips are most definitely rotating forwards, not backwards. So will it stretch out the back musculature? Yes. Is it making the anterior pelvic tilt or the tilt of the pelvis forward? Is it making that worse? Yes, it is. And the other thing that it's doing is it's further stretching out the glutes. As we discussed, when we sit, we kind of stretch out those glutes over time. So that's something that we want to undo by strengthening the glutes. So that's a classic reason that the toe touch is potentially irritating on the nerve, the sciatic nerve, potentially dangerous on a disc injury if you have that. But overall, it doesn't provide any solutions to the underlying cause of back pain, which is generally excessive sitting, and that kind of combination of tight hips in the front, loose glutes in the back. So it doesn't do anything to fix that situation at all. As a matter of fact, it makes it worse. So that's another classic reason, we don't like that. Now, there's not a perfect substitution for that one. We'll talk about, in future videos, we'll talk about kind of a more modern hamstring stretching approach. If you do feel like you really have some tight hamstrings that you want to stretch out, way better ways to stretch that than just touching your toes. But in terms of strengthening, this is where a hip thrust and a couch stretch, that's a great winning combo along with some core exercise. That's all you need. So a lot of times just simply taking out the toe touch completely from someone's stretching program can yield pretty good results. Okay? The third one that we're going to talk about is basically pure trash, in my opinion. I don't even know why this one's used. There are no substitutions for this exercise because it just pretty much sucks. And that is a Superman exercise. Now, for sure, we've had patients who are like, my back feels great after I do Superman exercises. I don't know, maybe that works for some people, but classically, if you want to mess up someone's back, a great way to do that is to have them do consistent, heavy, prolonged Superman exercises. There's no reason to exercise the paraspinals of the back if those are already tight. So if you're not familiar with the Superman exercise, let me demonstrate. This is an exercise where basically your hands might be doing some things. It doesn't really matter what they do. The point here is that it's a sustained arch. So what's going on here is my back musculature is most definitely firing, and as is my glutes. So this definitely does have some benefit in terms of stretching out the front of the hips, kind of like a Cobra pose does, producing that bow or extension will definitely open up the front of those hips. But what it does is it further activates that back musculature, and almost everyone with back pain, that's one of the root causes, is those back muscles are simply too active. So further activating them is just not helpful. And then what is it doing to the core in the front? You're kind of stretching it out. So in other words, you're training the core to be stretched out, loose, less active, and you're training your back muscles, which are already kind of irritable, to be more active. And I mean, it's pretty logical that that's going to irritate your back further. It does do some good stuff in terms of glute activation, but there's way better ways to do that with less irritation on the back. So again, there's not an exact substitution for that one because it just kind of sucks overall. Again, if you're looking for some general substitutions for that type of thing, again, the winning combination is going to be something like a couch stretch and a hip thrust. We jokingly refer to that kind of combo as the ass and abs combo, where we're trying to get the glutes and the core to work together. And again, that produces that posterior pelvic tilt, with the abs lifting the pelvis from the front and the glutes pulling that down so that the spine is nice and neutral, so it's not heavily arched and so that we're not stooped forward either. So that's what we're looking for. We're just looking for that Goldilocks zone in the middle. So we'll have some links to those exercises below. They're already on our channel, so you can go dig around there if you like. But if you're interested in reading more about these, again, Dr. McKenzie and Dr. Stuart McGill, those are some good classics on some of the underlying theory from kind of how these exercises came to be.